So here we have the Nidek CEM 530 specular microscope to evaluate the endothelium of patients' corneas. It's important to evaluate the endothelium prior to any anterior segment surgery or if you're fitting patients with contact lenses. So here I'm going to give you a quick demo of the CEM 530 specular microscope by Nidek. First, you're going to go ahead and select the fixation points that you want to evaluate. Now we can image central, paracentral, and peripheral. We can select one, or we can select three, or we can select all of them. So at this point, I'm going to show you how easy the device is and how the auto tracking function works by selecting three fixation points. So again, it is easy to use. It has auto tracking on the X, Y, and Z axis and alignment. It also has auto shot. So all you need to do is push the device in. It will take over. It's going to take our first endothelial cell image. It's going to automatically move over to the second fixation point, and then our third fixation point. So now you can see how easy it is to use. After the exam is complete, we're going to go ahead and look at our results. And into the result page, we're going to see the endothelium number of cells, the cell density, the average area, standard deviation, coefficient of variation, the largest cell, the smallest cell, the percentage of hexagonal cells, and corneal thickness. And with all that information, we're looking at pleomorphism and polymorphism. Now, not only does auto calculation and analysis, but we can also select the cells if we would like to do a manual count. Sometimes it could fail if the patient has a lot of corneal pathology. So by selecting a certain number of cells, we can do an actual manual count, or you can select reanalysis to reanalyze your automatic analysis. So what we have found in feedback from our users of the CEM 530 specular microscope is that it is simple to use because it has the auto alignment on the X, Y, and Z axis, auto shot, and takes a matter of seconds to calculate an analysis of the endothelium.